If the cost of eggs had increased the same amount as the cost of health care in the United States since 1945, a dozen eggs would cost $55. If the cost of a gallon of milk had increased the same amount as the cost of health care, it would cost $48. That's how much health care has escalated and what we pay for it, even though it's inadequate. In the United States, we pay an average of $7,500 per person per year. That's twice as much as the next country in the world with an organized healthcare system, and twice as much as England does, for instance, with its organized healthcare system. And where does this money go? A large amount of it goes to insurance companies. Again, as a practicing physician and as a social politician, I have to say that in my opinion, what's happening with insurance companies, it's the same thing that happened with banks. They're subsidized by the government and they're ripping off people who are sick for their own profit. Before I get to that, I'd like to quote another statistic which was done by doctors in our organization, Physicians for National Health Program, and it was done in conjunction with a professor from Harvard Law School whose name was unknown at the time. So it's co-authored by Elizabeth Warren. And it points out that in this country, 65% of all the personal bankruptcies are due to illness or medical expenses. So the tragedy of illness is compounded by the economic tragedy that these families undergo. And half of those people had health insurance at the time they got sick. Either their health insurance didn't cover the cost of their illness, or they lost their insurance because they lost their job due to being sick. So the statistics are overwhelming and overwhelmingly tragic. Now, to get down to the Occupy and we being the 99%, I want to share with you some facts about the financing of the healthcare system. Administrative costs take off the top 30% of all the money that's paid on healthcare premiums. The fact is that insurance companies have what they call the medical loss ratio. That means how much money they have to spend on medical care rather than retaining to hire their own staff and pay their own exorbitant salaries. So the actual figures for 2008 and 2009, which I have here for the 7 largest insurance companies in America, they only pay anywhere from 82 to 86% of the money they take in for health care. The rest of the money goes to themselves for intense bureaucracies and excessive salaries. Now again, the only way you can actually relate to this is to know the actual figures. So I'm going to quote the figures for 2009, when this country was debating health care and what we need to do to fix it. What happened was President Obama cut a deal with Wall Street, and he decided the way to fix it was to subsidize insurance companies by forcing everybody to buy insurance. Okay? And that was an extraordinary rescue of the commercial health insurance companies, which were in a death spiral. Let me tell you what a death spiral looks like. In 2009, the 5 biggest insurance companies, names you will recognize: WellPoint, United Health Secure Horizons, Humana, Cigna, and Aetna. They combined had a total net profit, after all expenses were paid, a net profit of $12.1 billion. That was 56% more than in 2008. Where you learn what was going on with the business model of insurance companies is to look at their number of enrollees. They made a $12.1 billion profit while they served 2 million less people. 2 million less. They still had 100,000 enrollees, but they had 2 million less enrollees. So they were charging more, they were covering fewer people, and they were making bigger profits. Well, if you follow that out, pretty soon there's only one person named Warren Buffett, who can afford insurance in the United States, until President Obama stepped in and he mandated a federal law to bail out the insurance companies. That's actually what the Congress approved, in our opinion, in 2009. To be more specific, let me tell you some salaries in insurance companies. The executive officer, the chief executive officer of Cigna earned $15.2 million in 2010. The executive officer of WellPoint earned $13.5 million, one person. Steve Hemsley, the head of United Healthcare, only earned $10.8 million. 1 year, in 2007, he earned 1/17 of all the money spent on healthcare in the United States. His salary's actually gone down, and it's still over $10 million. So the insurance companies impose an incredible, expensive, inefficient, wasteful bureaucracy. Now, there's another thing about insurance companies, is they're criminals. They're effing crooks, okay? In January 2009, the United Healthcare Group agreed to pay $350 million to settle class action lawsuits filed by physician and healthcare members over the fact that they underpaid providers in their network. In 2009, United Healthcare also paid $925 million in a class action settlement because its CEO backdated his options. That's almost $1 billion. So they're out to make money, there's no doubt about it. The other big part of the ripoff in healthcare comes from the drug industry, the pharmaceuticals. As you may know, in 2006, George Bush created Medicare Part D. Medicare Part D was like shuffling around, you know, the three nuts with the ball under one of them. So they had this big hullabaloo because they were going to pay for medicines for senior citizens under Medicare, but it forbid the federal government for negotiating with pharmaceutical firms for the price of medicines. And it also said that all the medicines that were previously paid for by the state for their welfare patients were now going to be taken over by the government, the federal government, at the higher prices. So I have here a report from the U.S. House of Representatives dated July 2008, which actually lists the manufacturers 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. And they got a windfall because of this legislation of $3.739 billion. That's money that the states saved by negotiating with pharmaceutical firms that was now no longer able to be saved because of the new federal law. You may not be a political junkie like I, but the congressman who negotiated that law was a guy named Billy Tarzan, and as soon as the law was passed, he quit being the representative from Louisiana, and he went to work as executive director of the American Pharmaceutical Association. So can you see why I say that as a practicing physician, I love the Occupy people, because you're putting all this on the table, how our country is run for the benefit of the corporations and how it's ripping everybody off with a devil-may-care attitude. They're ripping the foundation out of our democracy. To go on with pharmaceutical firms, let me point out that this is not dated, but it's 2010. GlaxoSmithKline had to pay the government a $3 billion fine for irresponsibly advertising its medication. I don't have the date here, but Pfizer paid a $2.3 billion fine. It was that big because it was the fourth time they were caught violating the same thing, and they had consent orders with the U.S. attorney that they would never do it again. They were inappropriately advertising their medications. So pretty much I'm going to stop there, except to point out one more major fact. That when you look around epidemiologically across the world, and this is in a beautiful book called The Spirit Level, published by two medical epidemiologists in England. The Spirit Level assessed using United Nations figures a whole bunch of parameters of social morbidity, not just infant mortality and life expectancy, but such things as alcoholism, the number of people in prison, the number of teenage births, mental illness, drug addiction. And they showed that across all the countries in the world that this was not related to how wealthy a country was in terms of its per capita income, but it was clearly related to the maldistribution of income, to income inequality. So when you have what Occupy is protesting about, a situation where income is greatly maldistributed in a society, you not only have more sickness, you have a whole range of social problems that are not going to be solved because the people that are running the country don't give a damn. So that's the end of my talk. It's only a few minutes, but I'll be glad to discuss things and take questions.